And I think part of that is the that Hippocratic Oath 2.0 that Dr. Jordan Schlane talked about last night. So one of the really exciting areas that's shifting is both healthcare education. How do we democratize that? How do we extend access to training clinicians around the planet? And how do we interact with our patients? I think a true revolutionary leader in that space is my brother from another mother, Dr. Shafi Ahmed, a surgeon out of London who's been a pioneer in VR surgery, digital surgery, and exponential healthcare education around the planet. Shafi.
Thank you very much. Thanks very much, and it's a pleasure to be here again at Ahmed. Dan has done a great job putting great faculty together, and it's really a nice place to be again in San Diego for this conference. I'm going to take let's go back once. If we go back, is that working? Oops, let's go back. Make sure it works. So it's playing. I'm going to talk to you about kind of the exponential surgeon, its role in education and healthcare. I also perhaps challenge Eric Topol's view the other day on how we can redefine the interaction between our patient and our doctors. So I think we need to do better. Healthcare costs are going up, increasing year on year, and it's no longer affordable. So we've got to think about smart ways of how we engage the public, the students, the trainees in the future in different ways of thinking, and also how we educate them for the purpose. This is a video from Dubai Futures Museum. It's a sneak peek of that future. I was at the World Government Summit in January, and Expo 2020 will be here in October of next year. I urge you to go and see it. You'll see this amazing stuff that's going on. This is the future of my operating room. It's the AR VR interface. It's the AI and haptics kind of work that might help navigate an operation in real time, both pre and post-operatively. It's use of images. So all of this comes together, and I think there's a great look at the future of surgery and for all of us and how we can look for that future. If we go further, if we go back 100 years, and look at this picture, for example, we're now looking at the futurists of 1924. And they were thinking heavily about actually the future is going to be different. They call this kind of radio doctor, the radio waves, going to be the way we interact with our patient in the future, looking at mirrors and other kind of utensils. What we're talking about, of course, is that future of telemedicine. Already people were thinking 100 years ago, we're going to do better and differently, and how do we come to a different condition? The problem with all this, of course, is that this human contact revolves around human touch, sight, sound, involves empathy, and all these things that we think are just synonymous with our relationship with our patients. How much of that can be changed? How much can AI and other interfaces help that transition? The question, of course, judgment and intuition, very much part of every surgeon making decisions in the operating theatre, may not be able to be replaced or augmented so quickly. So where does that relationship lie? So I've been experimenting in the last few years. A quick summary of my work I've done, of course. Back in 2014, I thought I'd use a Google Glass. And Raphael Grossman gave a great talk on Monday on VR, AR, and mixed reality. And we took the Google Glass and trained surgeons around the world using smart wearable tech. I trained 1,000 people on a live operation around the world in 2014, converging them all together so that they could connect using just a 3G or 4G connection. Now, I think Michael Frieber's in the audience here, I think, from Germany. So, Mike, you noticed this little video. So I thought there was no utility for Google Glass. It kind of disappeared off the radar. But 2 weeks ago, I was in, I think, Expomet in Germany, and I found the first real utility for a long while. And you can navigate a wheelchair using the wearable tech, the Google Glass in your face, and your head and eye movements would navigate you through. So I thought I'd share this video with you just because I think it's relevant. But excuse the music, I couldn't resist. Dr. Evil, I've become all of a sudden. I couldn't resist. Michael's, I think, invested in the company in Manivo, but do have a look at their work. Yeah, thanks, Michael. But of course, then it went to VR. So a few years later, I thought, okay, wearable tech's good. We can connect people using smart tech. What about virtual reality? Can we bring people in the same space together? And I did the world's first virtual reality operation in 2016. And on that day, I trained about 55,000 people across the globe just by using a simple Google Cardboard headset, a smart app, and a mobile phone, for example, where you can access information and knowledge on a global scale and bring people to your part of the world. And why not transport people for education to democratize that? Of course, the internet is full of social media. We are kind of social media addicts, whether it's Facebook, Twitter, or Snapchat for younger people. So I thought I'd actually push that a little bit further. Because obviously, I decided to do an operation on Snapchat. First live operation on Snapchat surgery, really pushing that boundary of what's acceptable. Because these are young people who actually use this kind of software. On that day, millions of people around the world interacted, and 56 million people interacted on Twitter with one operation, which was a hernia operation. So share my knowledge on a global scale by using smart kind of software that's available on every phone in the world. So think about differently how you share that information. But I thought, okay, what about if we bring people into the operating theatre with me? Because, we want to share knowledge, we want to sometimes learn skill sets. Can I use the mixed reality device that Raphael talked about the other day, the HoloLens? And can I interact with surgeons from different parts of the world, maybe London and maybe in Mumbai, all at the same point? Redefine that human interaction, for example. Hi, everybody. Hi, Shafi. So the HoloLens itself really allows us to reshape the way we connect people, we communicate with people, and also to be used in teaching and training. Initially, when you put the HoloLens on, it feels a bit strange, but actually in a few minutes it becomes quite normal. It feels like you're just discussing cases with people in the same room, for example, like we do in normal hospital practice.
We can come in and actually look at this content in full 3D. And obviously when you're working in this case, the medical field, having a full 3D understanding of a situation, for example, is really much more powerful in solidifying how you want to navigate it in your mind.
So those are polygonal human beings. Is that reasonable? Can you interact with those people? Actually, this could be the future of MDT, or the tumour boards. Actually, it's this getting away from this whole fact that we have to be the same time, same place together. It makes no sense. We're connected in a different way. So how do you use that in a different way? Of course, they call me the virtual surgeon, and I live in this kind of virtual world thing. How do we do things virtually and in that environment? And this is the future of surgery, of course, and Raphael gave some great talk earlier on Monday, but this is kind of the future that I think we're going to be in. With training, educational learning, and practicing simulation. It's around this way of overlaying images, and diacom images in real time in the operating theatre, making surgery more precise and more efficient, improving the outcome of surgery, improving the quality, and training long before we get to the OR to do an operation through real life. So these are the kind of things that we're going to be seeing very rapidly next 2 to 5 years in clinical practice and across the globe, this kind of virtual training stroke virtual world that we live in. But if we sort of move on from that, we're now also looking at training education with AR and VR. This is virtual reality. This is my company, Medical Realities, and we're creating the world's training platform in VR for patient journeys, for basic sciences, and for learning OSCEs and be trained in OSCE kind of examinations, as well as a platform for surgical training. So again, the virtual reality, augmented reality platforms are now becoming quite important and being more implemented globally. And there's great interest, of course, in many medical schools and universities around the world. The other thing we look at is the interaction in the operating theatre. When you're scrubbed up, you've got gloves on, it's difficult to move around. We're going to be using voice tech in the future. We're going to use voice tech, voice-enabled machines to do the classification during the operation, recording people. This is my Iron Man moment, of course, where you really feel that you can navigate through a scanning image on screen. We can literally do it yourself without asking for anybody else in real time. Imagine that, bringing in the EHR, bringing in medical record, looking at data, seeing what's going on, interacting it, then going to the AR world, planning surgery in real time. That's the fascinating world that we live in, and that's kind of the interaction that I believe is going to be second nature to all of us surgeons. If you look at surgery as a whole, my own profession, I'm a cancer surgeon based in London. Look at this whole curve of open surgery versus laparoscopic surgery, and now it's this future of digital or robotic and other kinds of surgery. There's a small interface there, of course. We drive laparoscopic so long and so hard, robots that come in, but they're not universal, of course, because of expense, etc. So how do we bridge that gap? How do we train people? How do we create democratization of standards around the world? So that's clearly going to be the area that we have to concentrate on most rapidly. But of course, digital surgery isn't just about the platform itself, it's about everything around it. Digital surgery is defined. This is a slide from the Verb team who I advise around robotics, the visualizations. It's around the instrumentation that are advanced, much more intuitive, much better to use. It's also based around connectivity and how do you get the data and actually assess surgeons much more robustly, more objectively rather than this crude idea of mortality and morbidity, which has been there for hundreds of years, that makes no sense. It's really hard to justify that kind of equation where you can actually do much better with data analytics. And of course, robots are coming in. We know there's going to be robot wars in 2020 with many robots coming into view. The Verb team, of course, back probably next year, the year after. Medtronic just released their robots coming out. Cambridge Medical Robotics in the top right-hand corner. Theirs coming out this year, much more sleeker and modular device. And Intuitive have been in the game for over 20 years or so. But they're becoming more and more sophisticated, smaller and more neater. So you can do microscopic surgery, take away the tremor from your hands, make you more precise. But of course, that's great. That's really far future. What about today? And how do we democratize those kind of standards? We go back to simulation, of course. This is Domenico Veneziano, who was here last year in X-Men. I thought I must show you his video, of course. He's working on latest technology. He's Italian, from southern Italy, creating the new kind of really advanced simulation, but analog versions with pumps and drills pushing blood through so you can simulate real blood loss, etc. And of course, his machine is designed by Pininfarina. Only Italians would have a simulation machine that was designed by a Ferrari kind of manufacturer. So it's amazing how they kind of do that, right? The Italians just know how to be very smart. But they've moved on. What they've done now, of course, they've looked at AI. We've not had this before. This is suddenly looking at errors during training. Can be more objective about the assessment tools. This is using computer vision, analytics, and AI interfaces. You can analyze as they're training what that expertise might be. And we'll see more and more of that coming in as you go through training. It'll be AI-driven, data-driven, and you have a much better outcome in the future, of course. But of course, sometimes robots are way in the future. We have to be kind of pragmatic. Can we replace some of that curve of lap versus robotic surgery, make it more comfortable? This is interesting. The next one is, here we are, play. Let's play. It's playing. So this is Dex Robotics from Switzerland. And they've created a device that replicates robotic kind of experience, but actually analog version. You could use that in laparoscopic surgery, for example, but then train yourself in robotic, but slowly. Not jumping at the deep end, where it's difficult, takes time and expense. So this is now allowing you to repeat the motions, if you like, of a robotic, expensive procedure. But of course, the OR is going to change. The whole OR will be digital, voice activated. We'll have computer vision. We'll have screens going on. And now, of course, we're going to have things like OR bots. This is a company I work with, who are now creating a kind of computer vision tool with looking at trays of instruments. We lose instruments all the time, right? Yes? We have this thing called never events in the UK. You must never leave a swab in someone's abdomen. You must never do this, right? Yet they happen. In hospital, we have 8 or 10 of those every year, for example. And a lot of that is around how you leave instrument swabs behind. Could you now just take a picture using AI analytics, showing what the tray looks like? Take another picture a few minutes later, say what's missing, looking very quickly. That's far better than counting, recounting, counting. It's inefficient. We lose something, you go through a whole hour, 2 hours looking for the instrument. I'm sure how you agree with me. So we can now use computer vision to look at trays in the future. I love this slide from Daniel. I borrowed this one from Daniel. Look at that convergence of where we are. And it is that convergence that we talk about, of course, because it's about this kind of world that we live in with technology, how it's going to convert at the same point of existence, where it's all coming together to impact both health and education. What's missing from here, I think, is interesting. What's that missing link? What's the thing that connects all of this stuff together? Well, actually, only a few months ago, of course, you see the launch of 5G in the UK, and you would have 5G phones, I guess? None of you? What's wrong with you? This exponential medicine. You should be going out there buying in their droves, of course. And 5G for me is that missing link. It's the thing that will connect us. Fast speeds. This is a real-time video of the speeds you get in 5G in London at 1.5 gigabytes per second. Yes, you can download a film in 2 seconds. More importantly, it allows that bandwidth for VR, for AR, for AI interfaces to work much better. The latency is 0.1 millisecond. And I call this 5G the covalent bond. The bond that we all want to create that kind of exponential technology kind of interface, if you like, to carry on with this connectivity that we so aspire to. And this is Lewis Hamilton, now 64 times world champion. He launched the Vodafone 5G network a few months ago. I was lucky enough to be with him. I've just become the ambassador for the UK for Vodafone for 5G in healthcare, looking at how we enable this to go better in a different way. But of course, now that gives us other utilities. This is the world's first 5G operation being done using using robots remotely in the eastern province of China. So can you imagine that now? No latency. The thing we fear about before is slowness, is speed, etc. Now we're overcoming some of those paradigms, of course. This is an interesting thing. This is my new way of diagnosis. The future will be this. Patients will come to us following this kind of pathway. They'll first go to a chatbot. Yes? A chatbot will triage their symptoms. This is, say, someone's got lung cancer, for example, as pathology. Have a chest X-ray. The AI will sort out the chest X-ray immediately, smartphone on your, with the result in your smartphone within a millisecond. You then go to have a biopsy. This is Auris. I think Catherine Moore is here on Monday to about robots. This is an advanced tool we can navigate through lungs, taking biopsy into the right area. You don't have to be a real trained radiologist to do it. You can be anybody soon. And then, of course, that pathology goes to the pathologist, which is an AI pathologist, gives diagnosis straight away. So the whole process of diagnostics will be much faster, much more rapid with the technology. And they'll come to us at the end with their principal surgical outcome. So that's the kind of thing we'll be seeing as we interface with digital health. Endoscopy will change, of course. This is, of course, now AI-driven. We will see this whole launch of various systems now at endoscopy level. And the GI Genus came out recently, okay, which is Medtronic, using an interface at endoscopy to pick out polyps. Now have a look at this video, see if you can spot the polyp in the picture on your left. Let's see who gets it right. Can you see it? Of course you can't. The AI can see it. Can you imagine I'd have missed that as an endoscopist? I'm not a great endoscopist, I'd have missed it. Look at that, someone picks it up, looks at it, looking closer and closer, and suddenly it becomes more visible. Isn't that incredible? So suddenly all your diagnostics will be AI driven, making our lives much easier. Talk about future very quickly, future like going to Mars by 2025. We're going to be going there at some point, so the world will be extinct. Greta Thunberg tells us we're going to be extinct by probably year 3000, maybe sooner, and the pessimists will tell you by 2050 we'll be extinct. So we've got about 30 years to figure out some of life's ambitions and healthcare problems. The Enterprise is coming up, X Prize, as you may have seen, how to create avatars in this kind of world that we live in. And Susan and the others who I work with, and Raphael, for the Avatar Medic, trying to create an interface where you could support train remotely. Not just on Mars, maybe the UK, maybe in conflict zones, in refugee camps, for example. The utility for Mars is here today. Drive quite hard about remoteness, the advantages of how we operate today in this kind of world we live in. This is kind of what we're doing with Avatar Medic. But of course, my ambition's always been to transform myself in real time, in real place, trying to, do this kind of beam me up Shafi routine. And I'm trying hard, of course, using my own kind of camera systems, photogrammetry, creating virtual human. That's my virtual human. So before, we had virtual humans in the future. This is me. Imagine that's trained by AI algorithms. It's got voice technology, natural voice post-language recognition. It could be me on the stage doing it for you and doing lots of training for many people around the world, replicating my and being far more intelligent with much more knowledge base than I would ever have, of course. But of course, the real problem, of course, is if you do that, how do you transport yourself as a hologram? This is my Obi-Wan Kenobi moment, trying to sort out life's problems. Can we create a 5G hologram in real time? We did this about a year ago.
Shafi, have a look at this.
Yeah, let me have a look over your shoulder. Oh yeah, I see what's going on there. I think I'll give some advice, Carl. No problems. Thanks for calling me. So now we're going to be using holograms. Because it's expensive. I've just travelled from Abu Dhabi via Bahrain, via London, to come to X-Men. It's been a long journey. It's been a tremendous journey. But imagine if you just transport yourself in real time using holograms, avatars. The virtual MDT comes to mind. The virtual consultation comes to mind. How are patients going to cope with this? Have we decided about patients? Are they going to be happy with this? I've done this in real time with my patients. It takes me 1 minute to adjust. When they realise it's you and you're talking to them in real time, they're okay with it. We haven't asked the right questions. We assume we're very paternalistic in healthcare. Actually, if you ask the right questions, patients are far more able to understand this better. This is the last, hopefully, clip I'll show you. This is a couple of days ago when I was in Abu Dhabi at the Health Summit. And what I did here, this is a link using avatars with smart technology. That's the head of the healthcare quality, who also knows Daniel, of course, who's met before. And she's connected with a doctor in China using, they're wearing a Magic Leap or mixed reality device. She's on a smartphone, an iPad, connecting, suddenly sharing images in real time, just using simple 3G or 4G connection. Suddenly, it becomes, before it's cumbersome with big headsets and a lot of technology, and now actually you can do it on an Android or a kind of iPhone. And so she's connecting with him as an avatar. You can't quite hear him because we couldn't get the audio out properly. But it's real time. He's got eye movements, he's got movements of arms and legs, he's in real time walking around. Imagine having 5 or 6 of them in the same space together. Suddenly, it becomes much more interesting. Next, of course, is the future about twins. And who wants to meet my digital twin? She's called Aurora, apparently. Soon will become digital twins, lots of data will come through. You may yourself become your own twin and offering clinical practice to people around the world. Last slide, a book's coming out in a couple of months' time, and hopefully you get a chance to purchase it at some point and share my worldly view around healthcare and technology. Thank you very much.